Hi, my name is Rachel LeBlanc, and we are going to do the head and face assessment for health assessment class. I'm going to do a head face assessment. Can you tell me your name and date of birth?
Shelley Goodwin, 41089.
All right, Miss Shelley, I'm going to go ahead and sanitize my hands prior to performing this assessment on her. Okay, for this assessment, what I'm going to have to do is I'm going to have to actually touch your head, around your scalp, on your neck, chin, eyes. Is that going to be okay?
Yes.
So we're going to begin with examining her scalp, her hair, and her cranium. So we're just feeling for any types of lesions, sores, knots, bumps, lumps. At any time that I touch you anywhere, please let me know if there's any pain that I'm causing. Her hair is clean, dry, everything is intact, there's no sores, no lesions, no pain anywhere, no lumps, bumps. Cranium is a normal size for her age and race. Was there any pain while I was touching your scalp?
No.
Okay. Alright. So next we're going to look at your cranial nerve number 7, and that's going to be the facial nerve. So what I need for you to do for me is I need you to puff up your cheeks. I'm going to push them in. Okay. Can you smile for me? And frown. Okay. All right. No, there's no one-sided drooping to the other side. Cranial nerve number 7 seems to be functioning properly. For her facial movements, we see that they are even and symmetrical on both sides. And we will go to the next section. Now we're going to I'm going to palpate her sinuses. So I'm going to do her temporal sinuses, which is right under your eyebrows. So I'm going to have to touch with a little pressure. Let me know if that's any pain. And right under her cheekbones. Nope. Pain or pressure. There's no swelling. There's no lymph node swelling. I'm going to check the cranial nerve number 5, which is the trigeminal nerve. And this, can you just give me a swallow? Okay. And can you clench your jaw? Okay. Looks good. Okay. Go to the next section. And on this part, we're going to be looking at your neck. I'm going to have to palpate around your thyroid, so I'm going to stand behind you. My hands are cold. There's no masses, no lumps. Can you give me a good swallow? No irregularities when she swallows near her thyroid gland. And I'm going to go ahead and we're going to name off the lymph nodes for this section. So that would be the next thing we're going to do. So you have a lot of lymph nodes in your head and neck area. So right here at the front is the periculum, posterior ocular mastoid. It's going to be here. The submental midline, it's behind your mandible right here. And then we got the submandibular. It's halfway between the angle right here. There's no swelling, no irregular knots. And then we've got the tonsillar, just down lower. And then we have the superficial cervical, just further down. And then the deep cervical. And then the posterior cervical and the supraclavicle. And those are the lymph nodes of the head and neck. Next section we're going to look at is we're going to palpate near your trachea. Okay? No pain, no tenderness. Okay, perfect. And then from there, we're going to look look at your eyes. So I'm going to hold a pen light, and I'm gonna want you to follow the tip of my pen light, and then I will look at your corneas, and I'll also check your pupils for the reaction time, and we'll make sure that the cervical nerve 2, which is your ocular nerve, is functioning properly. So if you'll just take a look at the pen light here and follow it without moving your head or neck. Okay. Now I'm going to take a look at your corneas. If you'll just look forward. Take a look at the side. And I'm going to check a look at your pupils. Just look straight forward for me. And straight forward. We're going to hold up a letter. If you could hold your hand over your left eye, so you should read this letter. What is that?
E.
Okay, hold your hand over your right eye. Can you read this letter?
X.
Okay, perfect. You can put your hands down. Okay, the next part of the assessment is going to be your ears. So we're going to take a look in your ears. We're going to make sure that they're positioned properly, aligned. There's no dry, flaky skin. And then we're going to do your cranial nerve 8, which is the vocal test, to make sure your hearing is not impaired. Do you have any hearing impairments?
No.
Take a look at your ear. Pull down. Does that cause any tenderness or pain?
No.
What about when I press right here? Seems to be clean, dry, intact, no scaly skin, no dry cumin in the ear. Look at earwax. Any pain, tenderness? Okay. I'm going to step 2 feet behind you, and I'm going to whisper a word. If you could please repeat the word after me.
Love.
Okay, I'm going to step behind your left ear.
Goodbye.
Perfect. Hearing is great. On the next step we're going to do, we're going to inspect your mouth. So when we do your inspection of your mouth, we're looking for any type of ulcers, any loose teeth, any type of infections near the tonsils, swollen glands, anything of that matter. So if I can get you to open your mouth wide. She does have a piercing. No broken or loose teeth. Go ahead and close. I'm just going to take a look at your gums. Can you push that lip out? Push your bottom lip out. Perfect. There you go. There's no ulcers near your mouth. Have you had any trouble swallowing?
No.
No. Have you ever had your tonsils removed?
Yes.
So she has had a tonsillectomy. On excuse me. On the cranial nerves number 9, 10, and 11, that is checking all of her movement. So I'll have you shrug your shoulders. Any problems or pain in the neck area, head and neck area, shoulder area? Okay, perfect. And then can you turn your head from side to side without pain or difficulty?
Yes.
Okay, perfect. I need you to say a couple words, repeat after me. I need you to say, I'm trying to remember the words, light, tight, and dynamite.
Light, tight, and dynamite.
Perfect. Okay, well, this concludes our assessment of the head, neck, mouth, nose, ears. Actually, on your nose, we need to go back to the nose. So, do you have any difficulty breathing?
No.
Okay, I do need to palpate near your nose. And I need to look in your ears. Any deviated septums or trauma to your nose as a child? No? Okay, do you have any trouble breathing through your nose? Can you take a deep breath in your nose? Perfect. All right. And this concludes our assessment, and we will finish up with the report later. Thank you.